Hello everyone, good morning. For those of you joining online and here in person in Dr. Stephen's Library, very welcome. My name is Aoife Lawton, I'm the HSE National Librarian, and I'd like to give a very warm welcome to our special guest here today, the President of the Library Association of Ireland, Miss Eileen Morrissey, who's also Wexford County Librarian. And other guests, the Chief Librarian of the Royal College of Surgeons in Ireland, Kate Kelly, and other guests. So this is actually our second HSE library strategy. And unfortunately, I missed the first one, which was launched back in the spring of 2018, but I have a very good reason why I missed it. I was on maternity leave at the time, and my daughter actually turns 6 tomorrow, 22nd of March 2024. And it's amazing when I think back and reflect upon all that was achieved in those 6 years and everything that we've been through as a HSE library service. So many achievements to look back on. And actually, if you look at the strategy, we include some of those achievements as building blocks for our new strategy. So we've come through a pandemic, a cyber attack, and as a team of library staff, I feel that we've emerged stronger and more united. At the beginning of the strategy, you'll see a reflective piece outlining some of our key achievements. So I just want to highlight some of them. So one of them is having B&A best practice available to everybody in Ireland since 2020. This is key to reducing information gaps without restriction to anyone in Ireland. It's invaluable aid for GPs in particular. It's a clear source of trustworthy information to a public often inundated with dangerous misinformation. We have created value-added services for the health service, such as an evidence service, information skills, research bulletins, keeping people that are really busy up to date with the most recent and up-to-date literature. We have standardised a lot of our systems. We have a management system for all our library services in the HSE, and we have a national central repository for policies, procedures, protocols and guidelines developed in the HSE. And we also have LENS.ie for repository of research evidence. So I want to talk just a little bit about the process involved in the creation of the strategy. And the key piece to this was really having a co-creation approach and involving our own HSE library staff. And they got out of their comfort zones and talked to people who use the library, who don't use the library, and found out what their current user experience is and what it needs to be. That really informed what we were going to deliver through the strategy. The next step was really creating a vision. So where do we want to get to in the next 5 years? And I have to pay tribute to my colleague Mary Morrissey, through her facilitation exercise, Clarify the Objective, helped us realise that vision. So the vision for the new HSE library service is an integrated library service providing instant access to quality health information through a network of library experts for the benefit of all. So the pillar maps and the vision maps into 4 pillars, and I'm going to talk about each of the 4 pillars and what each one is going to deliver very briefly. So the first pillar is integrated library service, and what that is going to deliver is universal access to core resources via hselibrary.ie. What I mean by that are electronic journals, electronic books, clinical decision-making tools, and eventually all of this will be integrated into the electronic health record. So you won't have to use multiple systems to get the information you need. We will have patient-focused libraries and open libraries. This is a reality in public libraries in Ireland and a really good model that I'd like to try and test in the HSE. A key focus is improved services to our staff based in community and primary care settings. Under the pillar of instant access, we will deliver a HSE library app, integration of evidence and summaries of evidence into routine clinical and managerial practice. We'll implement a second phase of the National Centre Repository, and we're going to explore ethical use of artificial intelligence for rapid delivery of health information to busy clinicians. Under the pillar of network of library experts, we need to invest and upskill our own library staff and increase our workforce, our capacity, but be mindful to celebrate the achievements along the way. And today is a really big achievement for all of our staff. Under the pillar benefit of all, we will deliver increased health literacy in the area of a targeted user population in Ireland. We're going to also focus on increasing awareness of HSE Library, what it is we actually do and deliver. We're going to double our existing active user base. So at the moment we have 15,000 active HSE Library members. We want to double that over the course of the next 5 years with a big focus on community-based staff. We're also going to tackle misinformation in the area of health. So a lot of things we need to deliver. So how are we going to get there? Well, our partnership approach has served us well for the last 5-6 years, and through partnership, both internal in the HSE, there's so many talented people that work in our health service. That's how we're going to get this done. Also through external partnerships with academic libraries, public libraries, and other interested stakeholders. We're going to upskill our own staff, and we will need further investment. But the key thing will be ongoing engagement with our user base, people that use the library, and making sure we're delivering what they need. So finally, why is this strategy so important? We're living in an age of artificial intelligence and misinformation. Librarians are the original information professionals, and we're very used to change. And my library staff, they're not afraid to experiment, not afraid to fail, and to learn from that. This is how we grow. We have so much to offer the health service. The feedback we received through an independent report demonstrated how the HSE Library Service offers significant return on investment to HSE in 2 key areas. We save clinicians time and we adopt principles of universal access. So there's testimonials at the start of the strategy. I would encourage you to read them because they speak volumes about the people behind the HSE Library and the value that we provide. So I'm going to thank people at the end, but now I would like to introduce our Chief Clinical Officer, Dr. Colin Henry, to formally launch the HSE Library strategy. You're very welcome.
Thanks. Thanks very much. Thank you. I'm delighted to be here to launch this strategy, setting out objectives, priorities for the next 5 years. And I know it's a result of collaborative work with you and your colleagues, both internal and external stakeholders. When I was asked to launch this strategy, I thought of 2 libraries that came to mind. One that is no more and one that is very present, both physical space libraries. So one was the Carnegie Library in Cork, which was burned down during the War of Independence in 1920, which was there was a philanthropist, Andrew Carnegie, donating, who had such interest in learning, and it was such a force behind the development of libraries. And he described libraries as the highest, something that outranks anything the community can do was to develop a library. It's a never-failing spring in the desert. And the other library I reminded of this last week, I found myself, I was visiting a site in a new service in Calvintown, my hometown. Like, I arrived uncharacteristically early, glad to know that. and I found myself outside the library where I grew up. And I was reminded, I'd forgotten what a sanctuary it represented and what a counterpoint it is to the demands of an information age that purports to provide information, but does so in a very unfiltered and over-demanding way, where everything is provided all at once, without space in the literal sense, or space in the metaphorical sense, for contemplation, reflection, and embedment of knowledge, which we don't see in the kind of unfiltered information we've got access to now. So a key part for me, that physical notion of a library, of somewhere where there's space to learn, where there's space to absorb, where there's space to identify the information you need, is a two-way street. It's demanding of the person who either logs into a library or attends a library physically to give back the kind of time that's required in the library, and indeed, from my memory of that childhood library experience, to do so in silence. I'm not sure if it's a strict rule nowadays with libraries. So the strategy is really welcome, because of course we do live in a virtual age, and people need information all the time, and none more so than our busy frontline clinicians who need, I know this in my own experience as a junior doctor and consultant, who in the middle of nights on call, in the middle of their days on call, when encountering different cases, need access to trusted information, you mentioned even misinformation. And when you look up, as I'm immersed at the moment in vaccination and measles, and you look up and you type measles vaccination, you get unfiltered information that you isn't vetted or is not always trustworthy and is often misleading to people who don't know otherwise. And one of the key components of this strategy is to provide trusted information to people to allow them to make their own judgments, including frontline clinicians who can find, as I say, that physical and mental space in many different areas, in hospitals right across the country, for learning, for information, for individual information cases that they may be managing, and for research. Digital transformation is a big part, and even reference to the library app, which is going to be really important. I know that from my own experience again, that will really enhance the ability of our clinicians to provide safe and effective care, having information to hand and trusted information. And that, again, going back to that misinformation, the idea that you're going to provide summaries of evidence and provide information training to healthcare professionals is really welcome, because again, from my own experience way back when we were looking at information, we had to look at different tomes, acta medicus, I don't remember those. We had to literally go back month after month to evidence. That was the pre-information. It's something you couldn't explain now to junior doctors who can access all the information at once. But the actual getting of information then took more time than the absorbing of information. So the idea of this strategy, enabling people to access the right information in the most efficient way, is really welcome. And I think also welcome the idea that when we go to healthcare service, we're not just focusing on our own staff, we're focusing on those who work in health service outside the HSE, including GPs, including Section 8, 38, 39 hospitals. We're all part of the whole healthcare family, and we have one common purpose, which is to provide healthcare for the population. And lastly, perhaps, in this area of high priority, is this idea of promoting health literacy, because in the digital era, there's an unfair advantage to those who are highly digitally enabled, and people who are not digitally enabled are disadvantaged. You have to think of older people, many older people are digitally enabled. Some will be at the digital scale. So part of our mission is to enable people to get the right information and to combat, as you put, misinformation, to make sure that we direct them in the right direction as to what their healthcare needs and their information needs are. So many thanks to everybody who collaborated in this work, and I'm delighted to be in this physical space, this sanctuary space, as a place of learning and reflection. And now that I pass you on to Anne Therese, who's the Assistant National Director of Research.
Thank you very much. I'm delighted to be here again, and as Eva mentioned, this is the launch of my second HSE library strategy, and I still remember those days. I joined the HSE a little over 5 years ago, and I came in the door and Eva let me on my own as she went on maternity leave. Was the development of the first library strategy was already on its way, and I had the honor of being there at the launch of that. And I think as we move on to the new period with a new strategy, which is fit for purpose for a new HSE as it is evolving, that we take a little time to think about the things that we have achieved. And I think if I touch a little bit on achievements, but very modestly, and I think sometimes the users of the library service don't really see, because naturally you arrive to the library to use a service, but you don't really appreciate the amount of effort that is going in the background to enable you to receive that service. So I just want to mention a few things that I think should be mentioned as we move to the next stage of the development of the library. One of the first things that changed in terms of how we operated was a new approach to procuring our digital resources. So before, the procurement of the digital resources was regionalized, and there was different access in different regions. but that was centralized, and we were able then to get better value for our investments. And also I think that process enabled one of the key objectives of the previous strategy, which was the access, democratization of knowledge, I suppose, increasing the access to the digital resources, and to making sure that everybody, regardless of where they were in the HSE, had access to the same resources. And not only that, as Eva mentioned, that kind of became the national digital health library, which is a key set of resources which are available way beyond the HSE, and as Colin said, include the Section 38 and other healthcare professionals outside of the HSE, and that is really important, I suppose, to enable clinicians to access that information when they are in need of knowledge to treat their patients, but not just digital resources in terms of evidence, but also point-of-care tools like EPSET, BHA best practice, and others that are really, really useful when you're in the thick of it. So other achievements include, for example, I think this is worth mentioning as well, this was a collaboration during COVID. The library had a key part to play in the standing up the national resource and access a repository for clinical guidance to enable clinicians to access the latest clinical guidance to deal with COVID-19. And this was a collaboration with CDI in the Office of the Chief Clinical Officer, and this received an award in, I think it was 2021, HSE Excellence Award, and it was an incredible resource to have for healthcare professionals so another thing that is worth mentioning, and Colin mentioned the sanctuary of the physical library sites, is a roadmap for the development of this sites that commenced with the previous strategy and has been implemented and continues to be implemented. So a lot of the library sites have been modernized, have been improved, and still more to do, but a lot has been done. And I recently went to the library in Cork University Hospital, and I have to agree with Colin that that physical space, especially in an environment where people are so busy they don't even have time to think, that environment where you can just go away and disconnect even for a few minutes to gather your thoughts and think is incredibly precious. And as we move to the new regions, it is a key part of the new strategy to make sure that awareness that those spaces are there, and connection with the staff in outside of the acute settings is also very, very important. So on top of all of that, I suppose there was a restructure of the management team and the teams in general that were able to provide virtual services. And the summaries of evidence is one of them. The training, the provision of training for staff digitally or virtually or otherwise is also a hugely popular service that the library provides. My final thing, the PPPT repository, which is a digital online repository for the national policies and procedures, which will be hugely beneficial for the regions as we move forward. So a single point of access to the latest policies that need to be used as opposed to documents that may be floating around somewhere on websites or on the internet. So I'll leave it at that, but I think all those examples reflect the massive amount of work that the library do in the background to make sure that the library users receive an optimal service. And I think at the very core of this is an intrinsic desire to provide the best patient care. So even though the libraries are not at the forefront of providing patient care, they are a critical enabler of this. And I would like to thank Eva and for her leadership in making all of this happen, and also all the library staff for all the work that they have pushed in implementing the previous strategy, in developing a new strategy, and I know the work that will come to put that into practice. And just to finalize my speech today, I'm very, usually as the head of research, I'm very keen that research infrastructure to enable management, governance, and support of research is embedded in the design of the new health regions, because research and innovation and education they need to become critical enablers of the health service that we deliver. And I know the library is a key piece of that support infrastructure for research, and I'm really looking forward to continue to work with Eva and with the library team as we move into the future. Thank you.
Thanks so much, Anna, for your thoughts and your presence here today. I have a couple of people to thank for the strategy, and then we'll wrap up. So I'm going to start with the strategy steering group, who are a number of nominated people from right across the HSE. They are the people that turn up and listen to me on virtual meetings 3 to 4 times a year. You offer advice, you share your experience, and I want to thank you for your invaluable contribution. And a big thank you to those of you staying with me for the new strategy, and you'll help me steer the path towards implementation. To the general managers of hospitals that are on the call, the operations and facilities managers of hospitals. Our libraries, with 28 of them, they're based mainly in hospitals. It's a valuable asset to you and your staff. It's directly linked to staff recruitment and retention. And there's a really lovely quote, my favourite one in this strategy is, every hospital should have one. So we will reopen a really brilliant refurbished library in Kerry and in Wexford later this year. We need to work together to improve libraries in Mullingar, Galway and Waterford, and they're the next 3 on the list. To community-based staff and people working in primary care, this strategy has a big focus on outreach to you, and please get in touch with us. To patient and service users, we are ready to partner with external organisations to tackle health information inequalities, and a special thanks to Christine Fenton for her ideas and her contribution to our strategy. For library staff who may be joining who don't currently work in the HSE, once this embargo is lifted, this is a great place to work. Come and join us. Equally, I will continue to work in partnership with collaborative agreements to reduce information access gaps for healthcare staff to the National e-Library for Health. To senior HSE managers like yourself, Tom, invest in the HSE library to improve patient outcomes and safety, to enhance service user experience. We do provide value for money, and we help busy clinicians make decisions based on the best available evidence. To the Chief Academic Officers, thank you for your feedback. Let's build on our success through more partnerships. We have really good partnerships in place with the RCSI for Bowman, for UCC and UHL. And we are open for talks for the remaining academic partners. To my international peers who are part of the 5 Nations Library Group, thank you for your input, feedback, and for sharing your expertise. Finally, a big thank you to my own HSE library staff. Without you, none of this would be possible, and for participating in the creation of the strategy, for experimenting with Lego, for learning along the way and sharing how you really feel about all of this. Some of you are overwhelmed by it, some of you are nervous, some of you are excited. I think most of you are ready for change. So this is a day to celebrate getting this far, and the future is positive. So thank you, and the strategy itself will be available online as a digital document at hselibrary.ie. Thank you all very much. And a recording will be made available also afterwards. So that concludes our online webinar. Thank you very much for your attendance.
Virtual claps.
That's it. Yeah,
That's good.